Hey, it's Austin James. If you're like me, trying to live your best life while living with diabetes, you can relate to worrying if you're doing a good job managing your diabetes. I use the Freestyle Libre 3 Plus sensor to get real-time glucose readings and see the impact of every meal and activity to make better decisions. The Freestyle Libre 3 Plus sensor can help me live life with diabetes on my own terms, and it gives me more time for the things I love, like being a dad and a musician. Now this is progress. Learn more at freestylelibre.us.
For prescription only. Safety info found at freestylelibre.us.
Mothers know all about life's tricky transitions. Thankfully, Ollie helps you prioritize wellness through every age, life stage, or magnificent mood change. Need a multitasking multivitamin that keeps up with you? How about an essential prenatal for you and baby? Ollie's got you through it all. Life's tricky. Your wellness routine shouldn't be. Get what you need at ollie.com.
I read Stephen King's horror novel, Thinner, when I was 14 years old. It was actually written under his pseudonym, Richard Bachman. Do you remember it? The plot follows Billy Halleck, an overweight, successful lawyer who accidentally kills an old Romani woman while he's driving. And because of his connections as an attorney, he doesn't face any legal consequences. However, the woman's father, a Romani elder, curses him by touching his cheek and saying thinner, which doesn't seem like that much of a curse, right? Anyway, Billy begins to lose weight rapidly, no matter how much he eats, and he realizes the curse is slowly wasting him away. So he tracks down the Romani clan to try to convince them to lift the curse. And that's where Novo Nordisk got the idea for semaglutide, better known as Ozempic and Wegovy. No, not really. But the pharmaceutical industry surely is as much like a horror novel as is beneficial to mankind. But that's not the scary tale I'm telling today. The reality of your pharmacy copays and the lack of available medications is scary enough. But to celebrate Halloween, I'm bringing you my second annual Halloween special, and I'm going to share true, scary stories of medical mysteries. See if you can figure them out before I reveal the diagnosis.
I'm Dr. Wendy Fish Guts Hunter, and I'm the spooky pediatrician in the graveyard next door. I'm that mad scientist you call for unconventional advice about your kid's health. I mix the potions, poisons, and witchcraft of modern medicine with the terrifying reality of parenting.
This first case is a story of how mysterious and frightening our nervous system can be. Not only has memorizing the cervical roots of the brachial plexus haunted medical students for more than a century, but the complexity of neurological diagnosis continues to pain even the smartest doctors today. Well, except for neurologists who handle these kinds of things with a very smug attitude. What's scary there is just how much neurologists lack a sense of humor, to be honest. So, our patient is a 16-year-old girl. She's active and healthy by most accounts. She presented with a troubling issue. For the past 2 weeks, she has been experiencing weakness and numbness in her right leg. Specifically, she noticed she couldn't lift her right foot up properly. That's a condition known as foot drop. And the numbness in her leg extended along the outside of her right lower leg and her foot. To make things more complicated, she described a sharp, pinching pain behind her right knee. So, despite these significant symptoms, there were no other problems in her body. No back pain, no signs of more alarming neurological concerns. When I dove deeper into her medical history, a few things stood out to me. For the past 3 months, she had been having constipation. Could this be related to her leg weakness? I asked more questions about her diet to see what she was eating and if that could be the problem. And yes, she had actually been restricting her calories for the past 2 years. I asked about injuries or trauma, and she had a partially dislocated kneecap a year earlier, but her foot problem had only been going on for 2 weeks, so I didn't think that was related. Next, I examined her. Her neurological findings were clear but puzzling. She had weakness in her ability to pull her foot upward. It was very profound. Her ability to turn her foot outward at the ankle and her toe extension were also weak, though a little bit less so. Testing her sensation showed me that she had decreased feeling along the outside of her right leg, the top of her foot, and even in the web space between her first and second toes. And as expected, the way she walked was not normal. She dragged her right foot during walking, especially struggling to lift it up and put her heel down with each step. The most important clue came when I noticed her weight. Her body mass index, known as her BMI, was 17.4. That puts her in the 8th percentile for her age. She had lost about 27 pounds in the past 2 years, with a dramatic change in her eating. Clearly, she had an eating disorder, but lack of nutrients in her diet didn't quite explain having weakness in just one foot. At this point, I was considering a wide range of causes. Given her symptoms of weakness, loss of sensation, and trouble taking steps, I thought of things like a lumbar disc herniation. Yes, that would be very scary, but that can affect a nerve root or even something worse. She might have had multiple sclerosis. There were no red flag signs, though, that pointed to spinal cord involvement, and her history and physical exam didn't really suggest a whole body issue like MS. So what was really going on here? After further investigation, we confirmed a diagnosis: compressive peroneal neuropathy. More specifically, this was peroneal nerve compression caused by weight loss. This nerve, which runs down the leg and controls the muscles involved in lifting the foot and extending the toes, is particularly vulnerable where it wraps around the top of the fibula. That's the bone on the outside of your lower leg. In this case, the patient's extreme weight loss had reduced the protective fat padding around her nerve, making it more susceptible to compression from her habitual leg crossing. Her neurologic defects, such as foot drop, weakness in the ankle, and sensory loss in certain areas of her foot, they all fit perfectly with the anatomy of where this nerve innervates. Compressive peroneal neuropathy is well known as a complication in patients who lose a significant amount of weight over a short period of time. The lack of fat around the nerve exposes it to damage from the surrounding structures, especially when a person crosses their leg frequently or sits in other specific postures. In this case, her weight loss was related to her eating disorder. It's important to recognize that this kind of neuropathy can also occur from other causes, like not moving, like from trauma or recovering from surgery. Fortunately, compressive neuropathy can often be treated with just changing your lifestyle and doing physical therapy. It's rare that surgical intervention is necessary. However, the key in this patient's recovery is going to be addressing her underlying issue of her eating disorder, which contributed to her weight loss and the subsequent nerve compression. This case serves as a reminder of how seemingly unrelated factors like dietary habits and posture can converge to cause a neurologic issue. But it also reminds us that fat is a very important part of our body. It cushions our parts, it insulates us. So take a moment to appreciate your cushions and the fact that you can feel and move your legs normally. And now, uncross your legs.
Imagine what's possible when learning doesn't get in the way of life. At Capella University, our game-changing FlexPath learning format lets you set your own deadlines so you can learn at a time and pace that works for you. It's an education you can tailor to your schedule. That means you don't have to put your life on hold to pursue your professional goals. Instead, enjoy learning your way and earn your degree without missing a beat. A different future is closer than you think with Capella University. Learn more at capella.edu.
Chronic migraine is 15 or more headache days a month, each lasting 4 hours or more.
Botox, onabotulinum toxin A, prevents headaches in adults with chronic migraine. It's not for adults with migraine with 14 or fewer headache days a month. It prevents, on average, 8 to 9 headache days a month versus 6 to 7 for placebo.
Prescription Botox is injected by your doctor. Effects of Botox may spread hours to weeks after injection, causing serious symptoms. Alert your doctor right away, as difficulty swallowing, speaking, breathing, eye problems, or muscle weakness can be signs of a life-threatening condition. Patients with these conditions before injection are at highest risk. Side effects may include allergic reactions, neck and injection site pain, fatigue, and headache. Allergic reactions can include rash, welts, asthma symptoms, and dizziness. Don't receive Botox if there's a skin infection. Tell your doctor your medical history, muscle or nerve conditions, including ALS, Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, and medications, including botulinum toxins, as these may increase the risk of serious side effects.
Ask your doctor and visit BotoxChronicMigraine.com or call 1-800-44-BOTOX to learn more.
How do you feel great on vacation? Like really good? Easy. You go to Aruba. You'll spend your time relaxing on cool white sand beaches and floating in healing blue water. You'll immerse yourself in natural wonder and find your center on an island where things move at your speed. You won't just feel great, you'll feel relaxed, renewed, and ready for life. That's the Aruba effect. Plan your trip at Aruba.com.
Next, I want to share this bizarre tale of a teenager who came into my clinic because he vomited every time he ate. What was strange about his case is that he didn't feel sick at all. No nausea, no abdominal pain. He felt totally fine. In fact, he was quite hungry, but he would just vomit about 20 minutes after eating. Before I explain more about his symptoms, it's important to know more about this kid. This was the first time I had ever met him, but he was very familiar with doctors' offices. He has a condition called neurofibromatosis type 1, or NF1. NF1 is a disorder that affects the nervous system and the skin, and it's something that people can be born with because it's caused by a mutation in a specific gene, the NF1 gene. This mutation is either inherited from a parent or it can occur spontaneously in someone with no family history of the disease. If a parent has NF1, there's a 50% chance they'll pass it on to their kids. One of the first and most noticeable signs of NF1 are café au lait spots. Those are those light brown patches on the skin. You probably have some. And many individuals with NF1 have at least 6 of them by the time they're just a few years old. They can also have freckling in unusual areas like their armpits or their groin. Another common feature is the presence of small, benign tumors. They're called neurofibromas. These soft lumps can develop on or under the skin and even along nerves deep in the body. And people with this disease can also have bone problems like scoliosis. That's curvature of the spine or bowing of the legs. It's important to know that even if someone does have this disease, it can look very different from one person to the next. Some people with NF1 have very mild symptoms, while others, they can have very complex cases. So this patient, I'm going to call him James. Because of his NF1, he also had a significant curvature in his spine known as scoliosis. James' spinal curve wasn't just cosmetic. It was causing pain, and it had the potential to get worse over time. So his doctors recommended spinal surgery to correct the curve and help him live a more balanced life. James underwent spinal fusion surgery. The operation went smoothly, and his scoliosis was corrected from a 50-degree curve down to just 7 degrees. His spine was now well aligned, and within a week, he was back on his feet and on the road to recovery. But as we know, the body sometimes has plans of its own. Within a few weeks after surgery, James started to experience something unexpected. He started to lose weight, just like in thinner. At first, it didn't seem alarming. We know that surgery can affect appetite, and some weight loss is usual, but this was not just a few pounds. Over time, James became more and more underweight. He lost 20% of his body weight. His parents were worried, and they made sure he was getting plenty to eat, but nothing seemed to help. He couldn't seem to eat enough calories. He was burning more while his body was recovering. Then things got worse. He started vomiting. Often and without warning, he didn't feel bloated or full. He wanted to eat, and he was starting to become more and more dehydrated. That's when his parents brought him to my office, fearing that something had gone gravely wrong with his surgery. My medical student went in to see the patient first, and she told me the story and said she thought he had a stomach virus. But something caught my attention, and that was his growth curve and the fact that he didn't feel sick, he didn't have abdominal pain, and no diarrhea. The growth curve showed he lost more than 12 pounds in just a few weeks. I examined James myself. His spine looked great. The surgical correction was holding up just fine, but something was clearly off. I sent him with his family to the emergency room, thinking that maybe I knew the diagnosis, but this kid needed more tests. After doing a few studies at the ER, it became clear from an upper GI study. His duodenum, a part of the small intestine, was being squeezed shut, creating a blockage. What was the cause? A blood vessel called the superior mesenteric artery. This artery normally sits above your intestine, just over the duodenum part. It had shifted in a way that was pinching his intestine, preventing food from moving through. This is a very rare and potentially very dangerous condition. It's called superior mesenteric artery syndrome, or SMA. What caused this? It turned out that James' weight loss was the key factor. While this condition can happen as a result of surgery, James had been fine for a few weeks. He had a different cause. The fat padding around the intestine had melted away as James' body lost weight, allowing the artery to compress his intestine. His rapid post-operative weight loss, that put him in a very vulnerable position. SMA syndrome can be life-threatening if it's left untreated. The constant vomiting can lead to severe dehydration and dangerous imbalances in the body's electrolytes. In James' case, he was already showing signs of severe metabolic problems. But there's good news. Once he had a diagnosis, he was able to be treated without surgery. He got a nasogastric tube to drain the contents of his stomach and relieve the pressure. And then doctors put a feeding tube down further in his intestines, going past the blockage to make sure he got the nutrients he needed. Slowly, his body began to recover. The curse was lifted. His vomiting stopped, and he gradually regained the weight he had lost. After a few weeks of close monitoring and careful feeding, he was back to his usual self, and thankfully, the symptoms never returned. SMA syndrome is rare, and it's even more unusual to see it develop weeks after surgery. But James' case teaches us an important lesson. The complications after surgery don't always happen right away, and they can present in very unexpected ways. If we recognize this early and treat it, it's crucial. And in James' case, catching this problem in time meant avoiding further surgery and long-term complications. Weight loss might seem appealing to some, but it can have serious, potentially dangerous health consequences that should not be ignored. First, when your body loses weight too quickly, you can lose muscle, including loss of your heart muscle, which weakens and increases your risk of heart failure. I've seen this happen in patients with anorexia nervosa. I've even seen deaths from arrhythmia. Rapid weight loss can also cause dangerous electrolyte imbalances, which can trigger an irregular heartbeat. The digestive system, that's not spared either. Fast weight loss can result in gallstones and liver damage, while prolonged nutritional deficiency can cause your hair to fall out, your skin to dry up, and your bones to become brittle and prone to fractures. Worst of all, sudden weight loss can cause severe metabolic damage. Slowing down your metabolism permanently can make it harder to keep weight off in the future and set you up for a cycle of unhealthy dieting. These risks aren't just short-term either. They can have long-lasting impacts on your body, some of which may be irreversible. Now you know that rapid weight loss is dangerous and the consequences can be life-threatening, and that's why you should go trick-or-treating and eat some candy. Now go.
For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a spooky question about the creepy things that kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the Pediatrician Next Door.
This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time
with more.